All right. Well, I don't want to jinx anything, but I think everything is working as it's supposed to, which is kind of a nice surprise. It's been that kind of week, and we always have some kind of tech issue or other to be worried about, so. But it seems as though everything is working okay, at least on this end. The levels appear to be okay and everything else. So hopefully you can hear me okay. If you do, or if you are having some audio problems, let me know, because that has always been kind of our Achilles heel at here at COPD Navigator. So I think we've got it though. All right. So, without further ado, welcome to BreatheTV, brought to you by COPD Navigator and myself, Mike Hess. I am a respiratory therapist, have been for about almost 14 years now. I've been active in the COPD community for about the last 5. We do this show here as part of our group on Facebook, also called COPD Navigator. Which is an online support group for people living with COPD, their caregivers, clinicians caring for them, anybody else with an interest in the world of COPD. We invite you to come check us out. You can also catch us on YouTube. We are slowly but surely putting together a website. Catch us, we're putting together some podcasting stuff, all that kind of fun, those fun things. Looking to build out a lot in this coming year. Hopefully got some of these bug issues worked out, and we're going to be moving forward. So what we do here is we have an intro segment that talks about some of the latest news of the week. Then we have our topic of the day, which today is mental health, and you can see down here at the bottom of the screen, because a lot of these issues can be troubling. I know it's kind of a cliche to use the word triggering right now, but I want to make sure that anybody who is in need of any kind of crisis support or intervention has a resource that they need. The phone number 211 in many parts of the country connects you with somebody who can then connect you with an intake center or a counseling service, that sort of thing. If you don't have that service available through 211, this is a national hotline brought to everybody by the federal agency, the Substance Abuse and Mental Health Support Administration. I may have got the words in the wrong order there, but in any event, call that number, and again, they can connect you with services and that sort of thing in your neck of the woods. So first off, speaking of news, first off, I want to say hello to Lisa and Bill and Judy and Geraldine, everybody checking in so far on this Wednesday evening. Hope everybody's had a great day so far and continues on that way. People who are not having such a great day are those folks who are affected by this thing called the coronavirus. Of course, this is on everybody's mind right now. So I want to kind of touch base a little bit about this. It does definitely have the potential to affect people with COPD, but this is one of those things where there's a lot of misinformation flying around out there. There's a lot of stuff where the media likes to get a good story and all that sort of thing. So I wanted to try to bring some order to the chaos here, at least from my perspective as a respiratory therapist and public health professional, to give you a little bit more idea what's going on. I got some information from CDC and from a reliable source called Pulmonology Advisor, which is online. This was recent within the last couple of days, so this should be pretty good information. And first off, I want to clarify this whole idea of a coronavirus. It's one of those things that really sounds scary. It's got this funky name to it. Really, a coronavirus is essentially a cold virus. Cold viruses are very similar to, are actually a form of coronavirus. Similar to the flu and that sort of thing. This particular one was somewhat unique in that it hasn't really responded very well to conventional therapies, and also it does seem to be a little bit easier to catch than a lot of other coronaviruses, but it is still very limited as far as who is at risk, because it does require some pretty significant person-to-person or pretty specific person-to-person exposure. You'll notice that on the caption here, it's called COVID-19. Not terribly long ago, within the last couple of days, as a matter of fact, the World Health Organization declared that this was going to be the official name of this little bug. for a variety of reasons. You know, pretty much everybody has heard of things like the Spanish flu and things like that. And in recent years, there's been a push to kind of get away from that because, and we've seen this particularly with what we're calling COVID-19. Excuse me, or at least that's the disease that's coming out of it. The actual bug is novel coronavirus 2019, I believe. We have been seeing a lot of discriminatory and assuming things of people coming out of China and that sort of thing. We've seen cruise ships getting quarantined even though they have no cases. There's been a lot of panic rampant out there. And in order to try to dissociate that, and we've seen it historically too, like I said, Spanish flu had a lot of issues with that. SARS had an issue, although that was less a regional thing. There was the Middle East respiratory syndrome, which again was a coronavirus. They're just trying to get away from the regionalization and stigma of these sort of things. So all that said, again, this is in general a fairly common thing. It's not the sort of thing that is like some kind of new outbreak or anything like that, new organism or anything like that. A couple of other tips to remember. Generally speaking, the virus is characterized by mild to severe respiratory illness with symptoms of fever, cough, shortness of breath. Here and there have been a few respiratory or non-respiratory symptoms like diarrhea and vomiting. Symptoms can surface in as few as 2 days or as many as 2 weeks. So again, this is very similar to other respiratory viruses that we see out there, flu, cold, all that sort of thing. This did start in a place called Wuhan, China. Whereas as of a couple of days ago, they've had a little over 6,000 cases on 132 deaths. Again, to put into context, there are tens of thousands of people who die from the flu every year, and yet we still have trouble convincing people to get a flu shot. So, can the disease be prevented? They are working on a vaccine for it right now, but again, these are some simple things that you can remember to keep track and to minimize your risk of exposure here. First of all, wash your hands. Hand hygiene is one of the best things that you can do to prevent the spread of any illness, including a lot of viruses. Don't touch your face with dirty hands. You know, if you're out and about, touching doorknobs and shopping carts and all that stuff, make sure you've got some sanitizer. Wash your hands before you do anything up here, especially nose and mouth, where it's a little bit easier for those things to get in. Keep your distance from sick people, especially if they happen to have been to China in the last couple of weeks. Stay at home if you feel sick, because that's going to stop the spread. Cover your cough, cover your sneeze. That's common courtesy. And again, these are all things that are going to stop any disease in their tracks. And make sure you're cleaning your surfaces and all that kind of fun stuff. Again, these aren't specific to COVID or this novel coronavirus. These are things that are going to be good ideas in general. And if you happen to be the third person on a chain, maybe a friend of a friend knew somebody who had some business over in China and they came back and touched, people with compromised immune systems, like any kind of chronic disease, including COPD, are going to be at increased risk. Also, people with COPD tend to be older than the average population, and people who are older than the average also tend to be at a little bit higher risk. So these are all things that are going to be put you at slightly higher risk. But in the words of Todd Ellerin, who is the Director of Infectious Diseases and Vice Chairman of the Department of Medicine at South Shore Hospital at Weymouth, Massachusetts, who wrote in a Harvard Health essay, unless you've been in close contact with someone who has the coronavirus, which right now typically means a traveler from Wuhan who actually has it, you are likely to be safe. We should not panic, is the key takeaway. In addition, Tracy Goldstein, professor of pathology, immunology, and microbiology at the University of California, Davis, so we've got East Coast, West Coast, added, the important thing to remember right now is that while there are a lot of cases, many of them are not severe. I'm not worried right now about my personal risk. And that's another issue that we have to consider whenever we're talking about any kind of epidemiology. There are a lot of cases, because this looks a lot like other stuff, there are a lot of cases that might be out there and are relatively mild. It's the worst of the worst that are getting reported. And so that's why it kind of looks like, oh, you've got coronavirus and oh, you're really sick. Well, yeah, because that's who we're finding right now. So again, take it seriously. Use your routine cleaning tips. Make sure you're washing your hands, all that kind of stuff. But again, don't 100% buy into a lot of the hype. Don't isolate yourself and build a bunker and all that kind of stuff, because that's just going to be counterproductive. There's a lot of other stuff that we can be worrying about rather than that. On some happier news, or at least some other more positive news, we've talked a lot in the last couple of years about this idea of vitamin D being linked to exacerbations and lung function and all that kind of stuff. Another study just came out. Again, Pulmonary Advisor published this February 6th. It was published online January 17th. Told us that patients with vitamin D deficiency did tend to have a little bit worse lung function and were at higher risk for exacerbations. This was another study that was done from one of the bigger studies that was done called Spiromics, where they go in and they look at, parse out some of the other data, and they found that in 21% of the 1,600 people that they looked at had vitamin D deficiency below normal levels. Most likely to be in people who were slightly younger. 62 years old was the average age of those people who were deficient, rather than 66, who had plenty of vitamin D, active smokers, and African Americans. Now, the other thing to remember is this time of year in particular, it's really easy to get vitamin D deficiency, because one of the key ways we get vitamin D is from the sunlight. And especially, I live in Michigan, so if you're in any of these northern climates or northern latitudes, wherever you are around the world, sunlight is less right now, and it's going to be the opposite in about 6 months for our folks who are down in the southern hemisphere. But anytime you're in the middle of winter and that sunlight goes down, you're at a little bit higher risk for vitamin D deficiency. So the upshot to this study was that for each 10 nanogram per milliliter decrease in serum vitamin D from the blood test, there was a 1% loss of baseline lung function, and they slightly increased, if I'm reading that right, it's a 10% increase in your risk of exacerbation over the year. So again, this is not to say you need to go out to your local vitamin center or retailer of choice and stock up on mega doses of vitamin D, because we don't have any evidence that mega doses or over normal, supranormal levels of vitamin D are protective in any way. But we do know that a significant number of people are low. Again, that was 1 in 5 of the cohort, so we can guess that about 1 in 5 folks with COPD have some level of deficiency, and the more deficient, the higher your risk. So make sure you're getting that checked out. And in the most positive news we have of the week here, we talk a little bit about what are called lay health coaching. A study came out. This was published in the Annals of Family Medicine Journal. This was a randomized controlled trial called the AIDS and Respiration, AIDS as an assistance, not the immune disease, respiration health coaching for COPD. And they looked at English and Spanish-speaking patients with moderate to severe COPD, and they found that through the use of basically health coaches who were not necessarily professionals, or a respiratory therapist like myself, or nurses or physicians or anything like that, they found that they had some success. They had these health coaches who they made sure to note had a bachelor's degree in some kind of health coach curriculum, received 100 hours of training in a health coaching curriculum supplemented by COPD-specific content given by a pulmonary specialist, including things like active listening, non-judgmental communication, which we'll talk about a little bit later on too, navigating the healthcare systems, which we all know is incredibly complicated. I have so many horror stories about that, and I work in it every day. I live in it. Creating self-management goals and the use of teach-back methods. All of that was part of the instruction. They worked with these folks for 9 months as a maximum of 30 people at a time. Accompanied folks to visits to primary care or pulmonary clinicians, sometimes both. They met them in the community or at home, did phone calls in between. They met about once every 3 weeks, which allowed them to have up to those 30 patients. And then the health coaches themselves met with a supervising pulmonary specialist nurse practitioner at least weekly. And it worked. they found that at the baseline, at the beginning of the study, inhaler technique and adherence to the treatment regimen were relatively poor among the intervention and non-intervention groups. And they found that by the end of those 9 months, the people who were receiving the health coaching were taking their inhaler about 1 extra day a week. The average adherence was 6 days instead of 5 days. They were more likely than the usual care to have taken their controller as prescribed for 5 of the last 7 days. So 90% of the people who got the health coaching took their controller inhaler the right way 5 of 7 days, as opposed to only 69% of the usual care. And they were 3 times as likely than the usual care group to demonstrate perfect technique for all inhaler devices. So technique is a huge thing that we forget to look at all the time. In about a month, we're going to be doing a BreatheTV that's talking about a lot of the different inhaler techniques, because a lot of them are different for a lot of the devices on the market. And these health coaches did a great job of doing that. So kudos to the health team. It's a big deal, because we know a lot of folks out there don't have access to pulmonologists. We know that a lot of primary care providers have difficulty keeping up on all the different devices and all that sort of thing. We know that respiratory therapists aren't as available as we'd like it to be. And if you want to drop a comment in there, I can tell you how to maybe help us get Medicare to look at doing some more telehealth stuff, like sharing these kind of things out here. But we know that formal healthcare access is limited for a lot of folks. So if we can train up some what they call the lay health experts, peer coaching, and that helps people, then hallelujah, we're happy about that. So with that, that's a summary of our news of the week here. So I appreciate everybody sticking through that. Let's take a quick spin. We've got Joanna, Alyssa, and James joining us today. James, hope you're doing well. James is a fellow clinician friend of mine. Hope everybody's having a great afternoon. Like I said, we are finally about to get some snow here in Michigan again. We've had very unseasonably warm and dry conditions throughout most of the winter. For better or for worse, sometimes it's good, sometimes it's bad. It is what it is. And then, let's see, I think we said hello to everybody else. So, sure, we're going to go ahead and close that window there. All right, so our big topic of the day is mental health issues. Specifically, we're talking about anxiety and depression. We can kind of see here, I don't know if anybody remembers the movie Inside Out. This was the character that represented sadness. And when we're talking about depression, a lot of people have this kind of assumption that we're only talking about this kind of general sadness and that sort of thing. It's a little bit more than that. There was, interestingly enough, about 10 days ago, another very excellent website and Facebook page called COPD.net posted a few different things about mental health conditions that were linked to COPD, and that was kind of a nice tie-in to this coming up here. And they did a great job of highlighting a lot of the things to look out for in chronic disease. You know, we're talking about where you don't even necessarily feel sad specifically. You're not crying or things like that, but maybe your energy level is very low for a while. You're not having the joy, you're not taking joy in things that you normally do. Whether it's a hobby, whether it's a craft, whether it's speaking with friends, family, whatever it is. Maybe you're noticing that you seem to want to sleep a lot, can't get out of bed. These can all be warning signs of depression. And unfortunately, anxiety, we're talking about depression at the moment. Depression is a very significant impact in COPD because a lot of it kind of starts with anxiety. There are not very many more anxiety-producing, anxious-causing fear sensations than not being able to breathe. And when you're dealing with something like COPD, you have that feeling a lot. I should say. It's my understanding. I haven't been down that path, so I don't want to tell you how you feel. But when you're feeling short of, I know how, the times that I've been short of breath, especially if I, something goes down the wrong pipe or something like that, that's really scary. And it's difficult for me to imagine dealing with that all the time. And so what happens a lot of times, we'll talk a little bit about, let's see, I'm trying to, yeah, here we go. So I'm going to see if I can make this a little bit bigger because it didn't come out really obvious here. So we've got this kind of vicious cycle. And we'll try and slide down over to this side here so it's not just a blank head here. We've got kind of this vicious cycle of you have some of these symptoms and so you start getting anxious. And so kind of the automatic response to being anxious with a lot of these things is to stop doing them. So you start having the cycle of, well, I'm anxious, so I'm not going to do that. And now I'm not doing anything. And now I'm not seeing anybody and I'm feeling isolated. And you start kind of spiraling a little bit. And you get what we call deconditioned, where you start losing a lot of the muscle mass, you start losing your endurance and stuff like that. You also have an increased risk for exacerbations, those symptom flare-ups. We see that a lot because just like anything else, if you're not using it, you're losing it. So your lung function is no different. If you start giving up on some of these lung function things, you start losing it. And so then when you actually call upon your body to do what it's supposed to do, doesn't like that, and so you start having the symptom flare, and so then that makes you anxious, and that makes you even less likely to do the thing that caused it. You start to go in the hospital more, and then you start getting frustrated and irritated and depressed and anxious because you're in the hospital all the time or you're in the doctor's office all the time. And it's tough enough to go with some of these things just with the routine therapies, the routine checkups and things like that. Or, on top of everything else, we know that people with COPD tend to have a lot of other stuff going on. So you've got your COPD visit, you got your diabetes visit, you got your heart visit, you've got your arthritis visit, you've got all of these chronic pain visits, you've got all this other stuff going on. You're essentially spending all your time doing stuff for other people instead of doing what you enjoy. And that's frustrating, and that leads to depression. It lowers your self-esteem. I had actually a patient not long ago tell me that they've been kind of trending down a bit for a variety of reasons. They've had some pain issues, so they ended up putting some weight on. They lost some of that conditioning, and now their breathing is a lot worse. And they told me, I feel like an invalid. And they started tearing up right there in the office because that's not what anybody wants, and that's not what we want as clinicians, but it can get into that. And for whatever reason, and I don't want to soapbox on this too much, we in modern Western whatever medicine tend to look at the mind and the body as these two separate things. And mental health is rarely covered and rarely prepared for in the usual physical health thing. So any clinician, like James, if you're still with me out there, any clinician who might be watching this, this was a common theme in a lot of the studies that I was reading while I was preparing for this episode. Anybody with chronic conditions, particularly COPD, since it is so invasive to a lot of people's life, has to be considered at risk for mental issues. Anxiety and depression in particular. And so these are the things that should be screened for at every visit, whether it's primary care, pulmonology, all the time. Anybody with these conditions, we need to jump on these things early. Because 40% of people with COPD, pretty consistently across a lot of these studies that have been found, are found to have depression, clinical actual depression. And so again, we want to look at context. You look at TV and you see all these ads for pills, and there's a lot of jokes, and it's like, well, boy, everybody's got to be depressed these days. Everybody's got issues, and certainly we have seen an upswing of it. But generally speaking, we see that 15% of the general population has, again, the clinical depression. So we see that there is a significant increase in your risk for mental health problems, mental health conditions, when you have a chronic disease. Because again, you're experiencing all of these things that induce guilt, induce depression and anxiety and frustration and anger, and all of these things put together. And when you're dealing with all of that all the time, it's easy to get overwhelmed. And being overwhelmed is a key thing that, again, you look at the themes that run through a lot of this stuff, goes right into what causes depression. On top of this, when we're looking at anxiety and things like that, some of the medications we use, we use albuterol, a very common bronchodilator. Albuterol and the other, the class is called beta agonist bronchodilators, are distant cousins of adrenaline, epinephrine. And so if you're using a lot of albuterol, which can happen when you're having a flare, or if you're at some of the more advanced stages, advanced phases, maybe you're getting kind of keyed up a lot and you don't know why, and you haven't really realized it, but you're just having the sensation of being up and on all the time, and that can lead to some anxiety. There are some studies that tell us things like inhaled corticosteroids can do that. The risk is relatively lower than with some of the systemic or oral things, the pills and things like that, but it is still there, especially when we have all these other things feeding into it. It's sometimes the death of 1,000 cuts, they call it. It's not specifically one thing that's a problem or one thing that's causing the issue. It's all of these things are 8% and 9%. Well, if you have 12 things that are 8 and 9%, well, suddenly you've hit the jackpot and you're at that stage where you're having these concerns. So can we treat these things is always the big question. And yes, absolutely. When we're talking about a lot of anxiety and depression treatment, we talk about what are the things that we can do to start fixing or start managing these things a little bit better. One of those things is kind of remove a lot of the triggers that are out there. If there are situations that are causing you stress, then stop putting yourself in those situations, which is easier said than done a lot of times, but is frankly impossible when we're talking about COPD, because it's not like we can just wave a magic wand and take that away. So we've got to start looking at some of the other issues and some of the things that we can control, we can manage, and figure out what are some of those things that can be effective in order to get people back on the more positive cycle, I guess. One of the biggest things is exercise. This is kind of a cliche, but everybody has probably heard of the idea of a runner's high. Now, I'm not saying you need to go out and run, because I know I'd lose everybody right there, turning the show off and saying, what a maroon, this guy doesn't know what he's talking about. Can't hardly make it to the bathroom sometimes, let alone go out there and run on a treadmill for a while or stuff like that. So I'm not talking about exercising to the point of getting a runner's high, but activity does tend to make you feel better. I know in my own life, I have had a lot of ups and downs, especially lately. I hesitate to label it with seasonal affective disorder or anything like that, but January tends to be kind of a frustrating month for me, and it's been a lot like that lately. I've shared with some of my friends, I felt kind of ineffective in a lot of ways. I've been dealing a lot with insurance companies that are frustrating with trying to get prior authorizations and getting the right meds for the right people. Dealing with kids are having some trouble in school, and coworkers are having trouble. I mean, there's just a lot of stuff going on right now, and I'm just not feeling great about it. But I feel better when I actually am able to get some exercise. My wife and I are not as regularly as we would like, but we are starting to get up, and we like to play tennis. And we're fortunately able to still do that, and we like to try to get up a couple of times a week and go play tennis. And I know on those days where I'm getting that exercise, I just feel better in general. Our bodies are generally designed to move, and when we do that, we're able to start feeling a little bit better about ourselves. This is another reason why pulmonary rehabilitation programs are so important, because these are programs where you can actually get that exercise in a safe, controlled, monitored environment, plus get a lot of the other education and socialization. We're going to talk about that. Let's see, does that come up next? Yes. Pulmonary rehab kind of bridges this gap between support groups and exercise programs. If you've been through pulmonary rehab, you know it's usually a class of The sizes vary wildly, of course, but there's several other people in there who, unlike me, the talking head on the screen, have actually been on this path. They have. You usually see a lot of people who are at various stages of COPD or airflow obstruction. They've got different levels of symptom burden. They've got different kinds of symptoms. But a lot of these folks have come up against the same issues, the same anxiety issues, the same depression issues, the same, a lot of these things. And again, I can understand them on an intellectual level, but I can't tell you I know how you feel because I haven't experienced that. But when you're in a support group, whether it's a virtual one like we have on Facebook at COPD Navigator, whether it's an online pulmonary rehab like At Home Rehab Network or Lyft, whether it's an in-person rehab, whether it's the prescribed, the initial stages, or whether it's the maintenance program, whether it's a Better Breathers group or a Harmonicas for Health group or any of the other things that are out there, it is absolutely critical for you to try and connect with some other folks so that you can have somebody to relate to. I saw a post on Facebook the other day that said it's really hard as an adult when somebody brings you a complaint, it's really hard to figure out, are you asking me for advice or do you just want to vent? And sometimes it's nice to just have that vent of somebody who has that common experience. And that's where these support groups really, really shine, is because that's what they're there for. You can all sit around the coffee pot and say, yeah, this sucks. And everybody else can say, yeah, it does. We feel you. And sometimes it's just nice to have that validation. So that's why support groups can be a tremendous role in helping people get through a lot of this stuff. We also talk a bit about therapy. We're going to come back to this in a little bit because I want to do a little bit deeper dive into specific kinds of therapy, or at least a specific kind of therapy, because therapy's kind of gotten a bad rap over the years. Again, we have, going back even longer, I think, than the division of physical health and mental health, we've had this idea that if you need therapy, if you have mental illness, if you are any of these things, then you are broken, you are faulty, you are weak, you are all of these things. And that is really not the case. It kind of ties into this whole ruggedness thing, and you should be self-sufficient and all that. And that's just not, humans are social animals. We should be able to rely on each other at least a little bit. And if you have an issue, it's okay. It's okay to ask for that help. It's okay to admit to it. We have seen that tide turning a little bit, but we're still dealing an awful lot with stigma. And stigma is something that people with COPD absolutely do not need any more of, because I've seen it myself. There are so many people who stigmatize the COPD community and assume that, well, if you're on oxygen, you did it to yourself because you're a smoker, all that kind of stuff. And we don't need to add any more of that on there. And so it's tough to fight through that and to make that brave decision to ask for the help, to call these numbers down here, to get that information that you need. But I cannot encourage folks enough to go for it. I mean, like I said, it's even still, I'm supposed to be the guy that knows, and I still have difficulty admitting sometimes when I need to talk to somebody, or when something's wrong. So it is difficult. That part I can relate to. It is difficult, but it is absolutely necessary to prevent going down into that isolation spiral and getting worse, because then that also affects your physical health and increases those exacerbations and everything else. The last main pillar of a lot of these mental health things is medication. And again, this is where sometimes the healthcare system adds to the stigma, or adds to the negative view, at least, because again, we have kind of a system where, okay, well, if there's something wrong with you, we can fix it with a pill. And there are very serious conditions where you have chemical imbalances and things like that do respond well to pharmacology, that do respond well to medication. But it's important to know that this is not the only solution. If you are not comfortable with medication, that's okay. If maybe you can try some of the therapy, some of the discussions. If you're not comfortable with discussions, maybe you want to try a medication therapy. The critical thing is to figure out what is most appropriate for your individual case. This is where it's no different than any other regimen in COPD. We try to individualize this therapy so that you can get the care that you need, that you deserve, and that's what's going to move you again back in the right direction and send you back up the spiral. So I said I wanted to take a moment and go back into one of the therapies here, specifically this idea of what's called a cognitive behavioral therapy. Before I get into that, I see that James has got some input here. I want to go back and just take a look. RTs who conduct pulmonary rehabilitation programs really need to be high energy and engaging while patients are exercising. Absolutely. This is another thing where it's really difficult to, I threw out the analogy of, well, doc or well, RT, I can't go 5 steps to the commode without getting short of breath, and now you want me to get on this treadmill. There's a lot of resistance, there's a lot of frustration, and it is absolutely critical for us in the clinical world to promote, to be the cheerleader. It's really hard sometimes because we've all got stuff, but it is, if you're in this role, it is critical. James says vital, absolutely essential that we've got to be everybody's cheerleader and keep pushing forward and overcoming a lot of that stuff. Patients who battle depression are not broken. Thank you. And again, sometimes it just comes down to that conversation, or tying back into to where we're going next. This whole idea of cognitive behavioral therapy. Now, I am not a therapist. I am not a psychotherapist. I am not licensed for any of that stuff. So I called in the experts, and I got some information from Mayo Clinic. So this is not just me spouting off some random thing I saw on a random website. Believe it or not, I mean, you can believe me or you cannot, that's fine. But the idea behind cognitive behavioral therapy, again, in the words of the Mayo Clinic, it's a common type of talk therapy where you are discussing things with a trained, licensed mental health counselor in a structured way. This is relatively short, generally speaking, as they describe it. Maybe a max of, I think they had 20 sessions on here. Can be very helpful either by itself or in combination with medication therapy or other kind of talk therapies, treating depression, post-traumatic stress disorder, which happens a lot, particularly in our folks who maybe have had an exacerbation severe enough to end up in the intensive care unit. Huge amount of post-traumatic stress in post-ICU patients. Not everybody has to have a mental health condition, a formally diagnosed one. Sometimes it's just helpful to deal with stress, because one of the things that this does is it identifies some of these trouble spots in your life. Sometimes it's difficult to figure out what's stressing you. Sometimes it's really easy, like I can't breathe all the time. I have trouble with that. Sometimes it requires a little bit digger, like saying, I feel bad because I think I did this to myself. And we can fix a lot of problems, but a lot of times it's hard unless we actually get to the issue. It's kind of like the idea of, an analogy I use sometimes is putting a Band-Aid on a bullet hole. You might stop the bleeding for a while, but you're not really addressing the underlying issue. Maybe you have an artery that is severed and that's what's bleeding out. And so maybe you can stop it by holding the bandage there, but you're building up pressure, you're losing blood and all this stuff, and eventually it's still going to rupture. You've got to actually figure out you've got to address that core cause, that root cause, and then actually take action to help that. But you can't do that unless you identify it, and that can be tough. The next thing that this is again a kind of a rule of 4 thing here, increasing awareness not of conditions or things like that, but your own thoughts, your emotions, your own beliefs. Again, humans are funny. We have, I saw it described one time as an almost infinite capacity to lie to ourselves. You know, we try not to lie to other people in general, but it's a lot easier to lie to ourselves sometimes. And again, we're not getting at that core issue unless we're able to identify and become more aware of what we're trying to hide or what we're avoiding or things like that. And again, this does not mean that just because you're trying to hide from something does not mean that you're weak. It doesn't mean that you're wrong. It just means that this is something that needs help. A lot of time there are weird stigmas in medicine. People who don't like to use their oxygen, people who don't like to talk about mental health stuff, people who don't like to use their rescue inhalers. And I'll tell you, as I'm sitting here right now, you'll notice that if you're a longtime fan of the show, go back and watch some of the old videos on YouTube or something like that. Sometimes I don't wear glasses. Sometimes I do. When I'm not wearing glasses, I am wearing contact lenses. I am sitting, we'll call it arm and a half length from the camera right now. And I have a camera that has the little screen where it flips around and you can monitor the image. I cannot see it from here. I can see it with my glasses on, but I cannot see it unless I'm wearing my corrective lenses, whether they're eyeglasses or contact lenses. Now, was I a little bit embarrassed about glasses when I was a kid? Yeah, okay. But nowadays, I have to wear my glasses or, you know, contact lenses or something like that. That's part of who I am. That doesn't make me broken, that my eyes don't work so good. And again, it doesn't make you broken if you need to go to therapy. It's another tool. It's eyeglasses for the mind, eyeglasses for the psyche. Oxygen, sometimes you need that. Again, doesn't make you bad. It can make you feel a little bit different. And that is something that can be addressed with a lot of these counseling things, but it doesn't make you bad. And that's kind of the key to a lot of these things. To try and that segues us very nicely into identifying negativity. Identifying negative or inaccurate thinking. Again, thinking that you're wrong or bad because you have these feelings, these sensations, these thoughts. Doesn't. We need to acknowledge when you have a very common thing is for a lot of people that have COPD feel guilty because if only I hadn't smoked. That's true. If you hadn't smoked, you probably wouldn't have COPD. Although again, 20%, 25% of cases never smoked. But okay, so let's move past that. Well, can we fix it? Can we go back in time and make you stop smoking? No. So what can we do now to help you live your best life? Again, it's really easy to get caught up in a lot of these negative things, and it's certainly a thing that you have to work through, but these kind of therapies and these kind of discussions can help move past that. I'm not saying that they need to be ignored or forgotten or anything like that. Quite the opposite. They need to be acknowledged, just like we were saying, increase awareness. But once they're acknowledged, then they can be integrated and you can move along with them in a more healthy, constructive manner. And again, tying back to not getting into that depression isolation loop, not having those extra exacerbations, not having all that stuff. Very important stuff. The last pillar of the cognitive behavioral therapy is again kind of going back to what we're talking about there with once you have identified all these things, try to move forward with them. Like, well, okay, so I have COPD. I know a lot of really cool people who have COPD, and we all hang out at the Harmonica Club, or we all really enjoy going to Pulmonary Rehab, and then we go for coffee afterwards. These are people I would never have met without this situation. Or, you know, there's dozens and dozens of other things. And again, I'm not going to tell you what you should get out of it because I haven't been down this path. But this is where those peer groups and those peer counseling things come into it, and they can open up lots of doors to help you get to where my goal is, where your physical health is not jeopardized by mental stuff. So again, I want to be very clear that these things should not be ignored. They shouldn't be diminished. It shouldn't be just a get over it kind of situation where you just need to toughen up or anything like that. These are all things that have to be discovered, acknowledged, processed, and then integrated. I like to say that because moving on seems like too much like getting over, and I don't want to encourage people to just get over it or feel like they should just get over it or just move on, but you've got to move with, and that way you can acknowledge, yes, I have this issue, but it's not going to limit me as far as the mental stuff goes. So maybe a little bit soapboxy, maybe a little bit confusing. This is a very intricate topic, and I only have the time and, frankly, ability to touch on it at a very cursory level. That's why I say things like talk to your local provider, your local team, whether it's your pulmonologist, your primary care provider, your local senior services agency, calling 211 or the help number there. These are the folks who can really help. These are the experts. My job is to kind of give you some hope that these options are out there, these things exist, and to encourage you to link up with them earlier rather than later. Because like many things with COPD or a lot of other diseases and conditions, the earlier we can start managing this stuff, the better the outcome is. And one last thing I really want to hit home to, this is not just for what we usually call patients. This is not just for the people living with COPD. This is caregivers too. Caregivers have a major burden that, again, often goes overlooked. We see a lot of times it's really easy for a family member or a friend to assume that they have to take on this burden of care for a person, and in many cases they do or are willing to, even going into it with the absolute best of intentions. It's really easy to get burned out, to get frustrated, to, man, this is a lot of stuff. Man, this is a lot of stuff that I have to sacrifice. These are a lot of things. And not only that, but it's seeing your loved one, friend, family member, whoever, even on the clinical side. This is something that we clinicians have to deal with too. We see these issues a lot. We get burnout, moral injury, frustration, all of these things as well. So if you are a caregiver, don't feel that your pain is any less. Don't feel that you are being selfish because you should just be sucking it up and doing it anyway. If you are a clinician, please don't feel that, I know I get into this sometimes too, where it's like, man, what do I have to complain about? This works, that works, all that stuff. I have a lot fewer issues than a lot of people. Your brain at the very core level underneath your consciousness doesn't acknowledge that. It acknowledges that it's in pain. It doesn't have that capacity to rationalize. It knows it's in pain, and that is what bubbles up. So when you're dealing with these things like the prior authorization requests that make no sense, or when you're seeing things that you have no control over, and you have to sit and hold hands or bite your tongue or whatever it is, your pain is very real too. Caregivers, people we care for, clinicians, all of this stuff needs to be addressed. And again, not ignored, not gotten over, not moved past or anything like that. Acknowledged, integrated, and supported. So, real heavy talk today. The bottom line is that help is out there, whether you are someone living with a chronic condition, whether you're someone caring for someone with a chronic condition, caregivers, clinicians, all of us. Help is available. Non-judgmental help, non-discriminatory help, non-questioning help. It's out there. Please access it. It can and absolutely should be customized. Again, medications can play a role. Talk therapy can play a role. Behavioral therapy can play a role, whether it's cognitive behavioral therapy or other. All of these things, exercise can play a role. Generally speaking, not one will do it all. Sometimes they can't. Sometimes your customized program is just one thing. There's a word for it, unidimensional maybe, or something like that. Sometimes that works, but if it doesn't, If you need more than one leg to the stool, again, that doesn't make you bad or doomed or anything like that. It just means that we need to customize the plan a little bit differently. And finally, you are not alone. Somebody out there, again, patient, caregiver, clinician, somebody out there has felt what you feel, has gone through what you're going through, and has come out the other side okay. Talk to these people. Find out what, sometimes just vent. I know James had mentioned that. A lot of times you should see some of the discussions we get into in respiratory Facebook and respiratory Twitter, these social media handles and stuff. Sometimes you just need to scream into the void for a little bit, or to talk to somebody who has been there and can say, yeah, that sucks. We have all been at various highs and various lows in our lives. You are absolutely not alone. Help and support are out there. Please take advantage of it. If you even think that you might be feeling depressed, anxious, isolated, upset, alone, any of these things, please access these resources so that we can prevent any other progress in your physical health, your mental health, or anything else, and so that we can help you again live your best life. Whew. So, heavy one today, folks. Heavy one today. Let's take a spin back through some of the, see if we got any comments, things like that. Oh, internal server error. That's fun. Reloading here. Oh, man. So, all those chat pop-ups have gone away. All right. So, we're going to have to do it the hard way and loop back around here and see where our comments are. So bear with me for just one moment. All right, so come on, why aren't we getting into any comments here? Come on now. So here is our tech issue of the week, apparently. That I can't, oh, here we go. That I can't figure out what I'm doing. All right, so let's scroll down a little bit. Geraldine, thank you for coming by. James, also, thank you for stopping by today. You had to peace out a little bit. Notifications from Frank and Judy and Ariana. Thank you for joining us today on a nice Wednesday evening. Forgot to mention, this is the part of the time if you do have some questions, whether it's about the issues we talked about today, whether it's about any of the news stuff that came through at the beginning, the lay helpers or the vitamin D therapy, coronavirus, get those in here now, vamp for a minute or two so we can have people get their time to ask some questions in here. Please feel free to drop some comments, whether you're watching us on YouTube or on Facebook. Go to either place and search for COPD Navigator. Our group on Facebook is called COPD Navigator. We have a page and a group. I know a lot of folks have kind of soured on Facebook these days, and certainly can't fault them for that. So we're starting to branch out a little bit and getting over into alternate channels like YouTube. So make sure that you are checking some of that stuff out too. Again, I'm running a little bit behind, but we always get our old episodes up there too. If you want to listen on the go, we're also starting to translate a lot of these things into podcasts. So you can go to your favorite podcast provider, Spotify, Google, Apple, all of those things, and search for COPD Navigator and get your dose of Navigator audio only style. So, let's see. So, we've got Sensei Mike checking in on YouTube. Where are all the viewers? I don't know. I would like to find out myself. We have a relatively limited following on YouTube. It's been, we haven't been doing the live shows on YouTube for terribly long. Because it took a little while to figure out how that platform works, and we generally have a lot of I shouldn't say a lot of tech issues. We get through them okay, but I appreciate Sensei Mike, DNP and mental health. Love my nurse practitioner folks out there. DNP, FNP, MSNs, all that stuff. Mary loved them so much. Got married one here. My wife is at work right now. She's a nurse practitioner. Deals also a lot with stigma and bariatrics. She and I have both been. Do we have any mental health questions? So I tell you what, we do have. If you're watching on Facebook, we can do a little bit of translation here. If you have any specific mental health questions, we do have a nurse specialist, DNP in mental health, available for the time being. So I know Phil says your first time here on Facebook. Appreciate you. So if you have a question on Facebook, make sure you're typing that in, and I can pass it along to our Sensei Mike different Mike on YouTube, or you can join us over there and ask a question directly. Also, I'm going to see here if I can spin around, and where is our group page? All right, so again, we have a group here on Facebook. So we've got no questions. We've got no COPD questions. We've got no mental health questions. Well, getting on the west, or where am I? East Coast here. It's getting a little bit late. Getting on to the 5:30 hour. Let's see. We've got Gary Aubin checking in. Hi Gary, Maddie, Terry. 10 more comments. Where are all the comments? Why aren't we seeing the comments? We got to go into the watch party. All right, we got some comments there. So we had 10. Don't have, can't see 10. So if I'm not seeing your question, I do apologize. Well, not seeing a lot of questions from the obvious sources, so we'll go ahead and probably tag out here. We'll give it another minute or so. Again, I do appreciate everybody coming by today. We try to do this about every 2 weeks. We have, let's see, we have in 2 weeks coming up, we're going to be talking about the always popular snake oil remedies. We've seen a lot of it, and actually just this week on Twitter, I saw about 5 years ago when I first started the COPD Navigator group. I started out actually in a couple of different groups on Facebook, trying to see if this was worthwhile. I'd done some research, and I thought, well, Facebook could be an interesting way to get some of this stuff done. Joined a group. The administrator wasn't around much. We'll talk more about this in 2 weeks. Suddenly came back and turned out he was basically claiming that he cured emphysema with a course of supplements and his mother that you could order from him for the low price of about $250 a month. That would take about 6 months. Absolute garbage. Didn't really like anybody questioning that sales pitch, and I just saw within the last couple of days this gentleman has popped back up on Facebook. We also had some, earlier this year, we had some stuff where it's almost like borderline snake oil because it's somebody with good intentions, but they don't necessarily know a lot of the details of how a lot of this stuff works. And they make a lot of claims that aren't backed up by anything. So we've got kind of intentional snake oil and we've got accidental snake oil, and either way, they're problematic. So we're going to talk about that in 2 weeks. The next show after that is all about inhaler techniques and all that kind of stuff. And then we've got a lot of other things planned through June. But if you have some ideas, if you have other questions, if you have questions after the fact, even if you're watching this on record, make sure that you drop them in the comments, because we do get notifications and we do try and answer every question or connect them to the right resources best as we possibly can. whether they're on Facebook, YouTube, wherever it is. That said, again, not seeing a whole lot coming through here. So we're going to call that a broadcast, folks. Appreciate everybody coming out on a Wednesday evening or Wednesday afternoon, depending on where you are in this fantastic world. Oh, Phil, got one just at the buzzer here. Been told by a doctor that having half my lungs removed. Is this normal and beneficial, or is it a bad choice? They've even mentioned lung transplant. Well, that's a great question. We have talked a little bit in the past, and this will be a topic coming up again, about this idea of lung volume reduction surgery, where they actually, when you have COPD, and I'm going to see, actually, if you give me 1 second here, I might be able to... If I can do this with the software or not. No, I guess I can. So there's this idea of lung volume reduction surgery, where they go in, and if you have the emphysema type of damage where it's kind of stretched out and what they call bulle and things like that, they can, a lot of times that is so stretched out it prevents the healthier part of your lung from expanding properly, and they can actually go out and cut a chunk out. It's usually not half, I don't think, but it is a thing that can be done, and there are some decent enough results with it, because what happens when that disease part goes away is the healthy part can expand and work more normally again. There are a lot of risks with it because it's a surgery, and it's a pretty intense one too. So they've come out with some other techniques where they can actually go in with a tube, called a bronchoscope, and they can close off parts of those the diseased parts of the lungs with valves and coils and things like that. And those can be helpful too. Those are a little bit newer, so some of the data isn't as new, but some of it they've been doing in Europe for quite a while too. So those would probably be things I would investigate before actual lung volume reduction surgery, traditional stuff. But it is it can be beneficial. This is one of those things where it really depends on the type of damage that's in there and a lot of the other factors that go into it. Can be beneficial, can be not so much. Lung transplant, that is another thing that, again, can be very beneficial. I know, off the top of my head, I know 4 people who have had lung transplants, who have had some very successful times and some less successful times. It's not necessarily a cure. Even the most successful case of lung transplant that I've seen described that basically for trading one chronic condition for another, because then you're on a lifetime of medications and lifestyle modifications and a lot of that stuff. So can it work? Yes, absolutely. Is it guaranteed? Absolutely not. So I would hesitate to say either one of those are normal. I would say that they can be beneficial, so it's a heck of a caveat. I would not necessarily say they're a bad choice, but just like we talked about with the mental health stuff, it's the right tool in the right person in the right situation. So take a look through. I'll see if I can get a link to the post where we actually did the video. We'll also be putting that on there. So If you follow us, if you head to our page on Facebook by searching COPD Navigator and looking for the lighthouse icon, or going to YouTube and searching for COPD Navigator there, looking for the same lighthouse icon, follow either one of those two pages, and then turn on notifications. You'll be up to date and you'll be get notified when we do these videos, and we'll definitely cover that in the future. So great question. Sorry for wasting a little bit of time trying to find the video. That would probably have done a better job of answering it, but hopefully that worked well enough for you. So we're going to do one refresh here, see if we got any other questions or comments, because we had Phil right at the buzzer there. Does seem like maybe we're calling it a day this time around. So, yeah. All right. You are very welcome, Phil. Again, appreciate everybody coming out today. Look for us in 2 weeks where we're going to be talking about snake oil. Come find us on Facebook, Twitter. We don't do the live shows on Twitter yet. I think that might be a possibility, but I don't know that many folks on Twitter. Come find us on YouTube. Tell us where else we should be. If you know somebody who could benefit from some of this information, please feel free to share the links with them. Don't forget to take care of yourself. Make sure you're calling resource numbers or getting resources that you need. Please take care of yourselves, take care of each other, and I will see you all in 2 weeks. Take care, everybody.